ಇವತ್ತಿದೆ ಸರ್. ಇವತ್ತಿದೆ ಸರ್.
ಓಕೆ.
ಇವತ್ತಿದೆ ಸರ್.
ಹೇಗೆ ಮಾತಾಡಿಲ್ಲ, ಎಷ್ಟು ದಿನ ಆಯ್ತು ಮಾತಾಡಿ, ಒಂದಿನ ತೆಗೆದಿಲ್ಲ ನೋಡು. ಹಾಗೆ ಮಾತಾಡಿ ಬರಲ್ಲ, ಕೆಟ್ಟಕೊಳ್ಳಕ್ಕೆ ಬರಲ್ಲ, ಇಡಲಕ್ಕೆ ಬರಲ್ಲ. ಚಂದ ಹೊರತದಲ್ಲ ಸರ್, ಅಲ್ಲಿ ಹೊರತದಲ್ಲ ಎಲ್ಲಿ ನಡ್ಬಾರ್ದು ತಗೊಳ್ಳಿ, ನಡ್ಬಾರ್ದು ತಗೊಳ್ಳಿ, ಹಿಂಗ್ ಸೀದಾ ತಗೊಳ್ಳಿ. ಎಷ್ಟು ನಡ್ಬಾರ್ಕಿಂದ ಅದು ಎಲ್ಲ ನಾನು ಇಟ್ಟು ಹೊಲಿಯಲ್ಲ, ಅದು ಪ್ಯಾಚ್ ಇರ್ತದ ಅದು ಇಟ್ಟೆ ಈಗ ಒಂದು ನಿಮಿಷದಿಂದ ಹಿಂಗೆ ಒಟ್ಟೆಲ್ಲ ಅವು ಎಲ್ಲೆಲ್ಲಿ ಹಿಂಗ್ ಪ್ಯಾಚ್ ನೋಡು, ಆ ಹೊಸ ಬಿಚ್ಚಲತ್ತಾವು ಬಿಚ್ಚಲಿಕ್ಕೆ ಉಲ್ಟಾನೆ ಹಿಡಿ, ಅದೇಟ ಹಿಂಚವು ಕಪ್ಲೆ ಮಾಡ್ಬೇಕಾಯ್ತು. ಕೂಸಿ ನೋಡ್ಲಕ್ ಬಂದಿಲ್ಲ, ಅಲ್ಲಿ ಹೋಗ್ತಾರೆ ಇವಾಗ ಮಮ್ಮಿ ಏಟ್ ಹೊಯ್ಕೋತಿ ಹೋಗ್ಲಕ್ಕ ಕಡೆ ಬಿಡು ಸ್ವಾಮಿ, ಏನ್ ಅವ್ನ ಜನ್ಮ.
ಸರ್ ಶುರು ಮಾಡಲ ಸರ್?
ಸ್ಟಾರ್ಟ್ ಮಾಡುತ್ತೆ, ರೆಡಿ.
ಓಕೆ. ಮೂಕಂ ಕರೋತಿ ವಾಚಾಲಂ ಪಂಗುಂ ಲಂಘಯತಿ ಗಿರಿಂ ಯತ್ಕೃಪಾತಮಹಂ ವಂದೇ ಪರಮಾನಂದಮಾಧವಂ. ವಾಗರ್ಥಾವಿವ ಸಂಪೃಕ್ತೋ ವಾಗರ್ಥಃ ಪ್ರತಿಪತ್ತಯೇ ಜಗತಃ ಪಿತರೌ ವಂದೇ ಪಾರ್ವತೀ ಪರಮೇಶ್ವರೌ. By saluting the Almighty, So we will start today's session on step-by-step learning approach for the subject of Roga Nidana and Vikriti Vigyan. In this particular session, which may run up to 90 minutes, so will be given by our most revered teacher and mentor, Professor B.V. Prasanna, former dean and professor, head of the Department of Roga Nidana and Vikriti Vigyana at STM College of Ayurveda, Kutpadi, Udupi, Karnataka. So, who is having the experience of more than 40 years in the subject of teaching in the subject of Roga Nidana and Vikriti Vigyana. So, I welcome you, sir, on this particular small interaction. Thank you, sir. Next, I would like to welcome to all dear participants who are eagerly waiting to have this particular interaction of how to learn the step-by-step approach of Roga Nidana and Vikriti Vigyan. So the thing is, so as I have mentioned, it will be a 90-minute session, and if possible, so make yourself as the mute yourself, and if ideal, if you are keeping your video on, it will be ideal, and if necessary, take lots of notes, so probably which may help you. And as it is a 90-minute session, keep the water with you for the hydration purpose. So with this, I would like to start the session. Yes.
I think, shall we start?
Yes, sir. Yes, sir. I actually request our sir to say the first of all, whatever may be the thing, so we need to have the strong why. That is very, very essential to have the deep understanding of any of the learning. So in this particular regard, I will like to ask our Prasanna sir to say why. So this study of the Roga Nidana is essential in learning the subject or Ayurveda also. What may be the three main reasons to learn about this particular subject?
Well, first of all, I would like to thank Dr. Gopi Krishna for the invitation.
Hello, please mute yourself. Dear participant, please mute yourself. Yes.
So actually, from that point of view, I really thank him for this opportunity that is being going to share my views. Because for the last 30 years, 30 to 35 years, sufficiently enough, I have taken plenty of time of our students. And at last, most of them may be relieved also. Even I happy that a few of the listeners are there. I also welcome them for this interactive talk. Friends, Dr. Gopi Krishna asked you one of the questions now. Why do we want to learn Roga Nidana? It's really a very pertinent question to answer. Here, a step-by-step study of Roga Nidana is there. So in that point, just I would like to add another point, that's study and teaching methodology that may be adopted during the course of this learning of Roga Nidana. Well, there are a few reasons why we want to study Roga Nidana as well as Vikriti Vijnana. as far as possible, I am not in a position to deviate my information from the text, what I have learned so far, because they are the most authentic sources. Those informations are universal. Those informations have no chance to change at all. And no extra could be added to that other than what they have already mentioned. The only thing is to improvise our knowledge, to simplify our thoughts. We can be in a position to interact with each other. This health and ill health are the two important parts and parcel of our life. And every time we must be in a position to seek that. We must have to be in a position to lead a very compatible life. Our environment should be in such a way that it has to support us. We have to support the environment as well as the environment has to support us for a better health of an individual as well as for the people around us and the entire society. From the point of Roga Nidana, when you speak that, first thing why we have to study is, we should know what exactly is the point of health, what exactly is the point to be known in the form of an ill health. And to reach to the goal of being health, if at all we come across with ill health, what are the methods to be adopted? That's why Hetulingaushadha Jnanam Swastha Athara Parayanam. This is the reason why we have to study Roga Nidana. Look at that. For a Swastha Parayanam as well as Athara Parayanam, Param Ayanam means the best approach or the best way or best track through which we have to move. And we have to identify whenever we're either in the disease situation or in the healthy situation, what are the next things to be known? First, if we are healthy, we should know the reason behind our health. We should know the reason behind the lakshanas that are behind our health. And later is Aushadha Jnana to maintain our health properly. That's why Swastha Parayanam. Second point is this, where Athara Parayanam refers to the fact that if at all we are having certain discomforts, disorders, diseases, whatever the word you use for that, then also must be in a position to know the reason behind it, the cause behind it, the features that are already associated with that condition, and later the remedial measures. So that means among the three, two of them are intricately related with Roga Nidana, Hetu Jnana and Linga Jnana. Unless we know these two, it is impossible to decide the Aushadha Jnana. That's the reason 66.66% of this Ayurveda Jnana depends upon the Hetu Jnana and Linga Jnana. That's why from the point of this condition, we have to study Roga Nidana. If we do not study the Roga Nidana, we are not in a position to identify the cause and the effect and then remedial measures. If you want to see that remedial measures are to be followed, invariably we have to study Roga Nidana. That's one of the reasons that should be known. Second, these are in a process to undergo this. That's the reason. Specifically, the clearly explains the fact. First, we should know what exactly the what can we call it, disease process that has been resulted in a body. Roga Madhav Pariksheta. First, then only the part of Tato Nantaram, Aushadam, Tata Karma, Bishak, Paschat, and all that. So, Naturally, when you identify that as Roga Madhava Parishata means invariably, first step is to know the Roga Nidana. Then the next two steps, Aushadha Jnana, then the further remedial measures in the form of karma, tata karma, Vishakpata. And all this must be done competitively. Jnana Puram Samacharat. Simply knowing some features of a disease and then treating that lakshanas doesn't mean that we know Roga Nidana. That's why first why we have to study is Roga Madhava Parishata. If we want to know what exactly the disease is, how exactly the disease started, we should be in a position to know that. That's why the reason is behind that. In case, if we do not do that, there are plenty of people are there who can consider to be even more well-versed practitioners also, but no knowledge of the medicine, the sense of the disease process or in the counter the remedial measures. They will just click it on that, like what you can call the practice of having no knowledge about them. Yastu rogam avijnaya karmani arabate bishop. Aushadha vidanajnaha tasya siddhihi yadruchaya. See this. His success is only a chance factor. It's a chance factor. If at all somebody says, I forget about that, why and how the disease will start, you see the symptoms and start giving the treatment. And it definitely clicks. If it clicks, it is by chance. Because we do not know any pros and cons of the disorder now. That's the reason we have to know Roga Nidana or Roga Vijnana properly. If not, it is incomplete. That's one of the reasons why we have to look into that. The most important thing is the third reason why we have to do that. At the time of interventions, simply features like lingam as mentioned, lingam, what Charaka has mentioned, is not simply the lakshana or a pura rupa. That word lingam there invariably refers with pura rupa may be there, lakshana may be there, sadhya lakshana may be there, arishta lakshana may also be there. Let's remember that. Ketu linga aushadha jnanam, in that linga jnanam refers to all of these things. They should be understood. Why we are talking is, there may be the appearance of lakshanas which may subside by themselves. No intervention may be required at all because our sharira itself is in a position to counter those type of factors. But there are so many situations where it may not. If you just neglect a bit, allow it to continue further, it may lead into the bad prognosis. That means when the patient or author comes to us, we must be in a position to decide the prognosis of the disease too. Where exactly the patient may lead after undergoing the treatment. So for that we should know what exact situation the patient has come. Is it not? That's the reason. Again, come back to that. Adhya sadhya yubhagajno jnana purvam chikitsakaha. Look at that. Adhya sadhyata of a disease must be known to a physician. Unless you know the Roga Nidana, you are not in a position to make out that. Adhya sadhya lakshana has to be known. If you know Roga Nidana very well, because it is one of the stages of the Samprati there where we can be able to make out. Isn't it? That is in the Bheda Avastha. That's what the situation of Bheda Avastha of Samprapti, as we mentioned, in that all the Sadhya Sadhyata depending upon the Upadrava, depending upon the Arishta Lakshana. So this, if you are in a position to know that, at that stage, if the patient has come, we should not be in a position to treat the patient. We should not even treat the patient because ultimately it may lead to many of the unexpected outcomes from the point of religion. That's why it says, Sadhya Sadhya Vibhagajno, Sadhya Sadhya Vibhagajno, Jnana Purvam Samachare. Kale, at the right time. Our intervention should be at the right time. Kale, charhavate karma. Kale, charhavate karma. Yattat sadayati dhruvam. Whatever that considered to be sadayati, definitely it can be cured and can be relieved. Conditions can be relieved if the timely intervention is. If at all it is not done.
Hello, please mute yourself. Yes, sir.
Yes. If at all it is not done at that right time, then it will lead to Artha, Yasho, Vidya. Then one more is Anukrosham, Vidya Hanihi, Anukrosham, and then Asangraham. Invariably, his success will be lost. His reputation is at stake. His knowledge is lost. Vidya is lost. Then he may get the untoward reflections of the society. Anukrosham may be there. So because of all that situation, that's it, say, Prapniyat niyataha vaidyaha yo asadhyam sumapataret. So if at all person makes ventures to treat a asadhya vikara, he may have been fallen into these consequences. Hence, Roga Nidana should be known properly. This is the third reason. So that means understanding of Roga Nidana ultimately gives a comprehensive nature of a disorder, comprehensive stages in which a patient must have come to us. Accordingly, what are the measures to be taken? If not, that to keep the patient informed in advance about the later consequences that may result there again. If you do that, your reputation will be maintained. So keeping in that point of social reputation also, we must be in a position to know Roga Nidana. So these are the reasons, Dr. Gopakrishna, why we have to study Roga Nidana.
Yes, sir. As sir, to summarize, dear participants, the first thing is Hetu and Linga Jnana. That is considered to be almost 66% of the whole Ayurveda learning. So that is basically depending upon our subject. Hence, we have to give more and more stress towards the learning of this particular subject. Second main reason, Rogamado Pariksheta Tato Anantaram Aushadam. So that means whenever if you are planning to give any kind of the treatment as such, so the ideally you have to, first of all, you have to identify what particular disease a person is suffering from. What might be the Srotas is afflicted, what might be the Asha is being afflicted, and what is the actually from where this particular source of the pathogen is entering into the body. So whether is it the mild or virulent pathogen or the karana, that is essential or not, that has to be learned. So if you are able to look into these aspects, then planning the treatment is not at all a difficult thing. So whenever if you look into the planning the line of treatment in the sense the whole body, whenever if you look into that, the Roga Marga is here, the knowledge of Roga Marga will be helpful. So wherein from the either the Bahya or Madhyama Roga Marga, we have to bring the dosha into the Abhyantar Roga Marga. Then that has to be eliminated either through the Vamana or Virechana or even the Basti, etc. And that, so that's how, so the Tato Anantaram Aushadam. So that is the second major point as such. And third major thing is, so that is the Linga Lakshana, or Linga is not at all related to only the clinical features as such. It could be either the premonitory symptoms, it could be either even the symptoms also, it could be either the complications, whatever the features are observed during the complication stage or during the Upadrava or Arishta stage, all they are coming under what do you say that under the umbrella of Linga or Lakshana. So that means we are going to get a overall comprehensive understanding of a disease process can be understood. So coming to the next this question as such. So that is how health is defined in the present context. In what way the Roga Nidana is helpful in the health sector?
Not asking you.
Hello? Hello? Is it audible?
Hello?
Hello, sir, audible is yes, sir?
Yes, sure.
Yes, sir.
I can hear you.
Yes,
Ah.
sir. Okay.
If anybody have any questions, let them definitely raise it.
You can raise it. So, yes. Okay. Yes,
Okay,
yes.
fine.
Just a minute.
Right.
So, can we have the questions at the end? So you can put it in the what do you say that the comment box, which is specifically being given on this. So in the chat, so you can give that. So we will be having the question answer session in the later portion, right? Sir, now the question is.
No, we can continue with that, right?
Yes, sir. Yes, sir.
Yes.
How the
Thanks,
health is.
Dr. Gopikrishna, because
Sir.
you have added so many informations which ultimately fits into this Eklinga Jnana. Nice thing.
Thank you, sir.
Now the question is, 10 perspectives from the point of present thoughts, and was there any deviation from the earlier thoughts? This thing to be known. First of all, even the present definition of health suggests that it is a state of a mind where there will be the well-being in the form of what can call the physical well-being or a mental well-being or a social well-being, and now another is spiritual well-being. So if there is a well-being in these conditions, we can say that the person is healthy. The question is, what is this physical well-being? How this has to be monitored? What is the mental well-being? How this should be known? What is social well-being? How can be understood? What is the situation of spiritual well-being? From that point of view, just look into this information. There is a clearly classified like 4 aspects. I don't definitely go into it, just I will name them. It's a self-explanatory. In that situation, we can be able to make out both physical, mental, as well as the social well-being. That's what. Hitayo, ahitayo, sukhayo, dukhayo. Those are the 4 choices are there. We can be in a position to see that according to the choices that we can make, we can live like that. We can preferably see that personally, we can be in such a position that all facilities are there, all comforts are there, all lavishness is there, all health situations are in the individual situation. Consider it as sukhayo. Isn't it? That's why where physical, mental well-being will be there in the patient, who can, by a person who can definitely lead a good life. Dukhayo means he himself is always in one or the other agony, or his mental well-being may not be good. He may be an antisocial. He may be in a position not to find the happiness in anything. That's a dukhayo. It's individually, he is not leading a proper life because of either the indiscipline or non-availability or a poverty, whatever the situation. That's a dukhayo. Come back to social life, social well-being, hitayo. Always see that you are not the only being found in earth, found on this earth. There are so many other beings are there, maybe the animals or maybe the plants and trees, and maybe the human beings who are living with us. See that the well-being of all this ultimately keeps you healthy. That's a social well-being. That's what hita ayu. That's the reason. Invariably, this physical, mental, social, and the spiritual well-being is self-explanatory. Dharma, artha, kama, mokshanam. Very clearly says that. Aragya is important. So, if this spiritual health is maintained, all this can be fulfilled. Even the salvation in the form of moksha may also be attained, provided we are living with spiritual aspects. That's the reason. Health from the present aspect, health from the earlier aspects are not much different. Think of. Then how to measure these things? So nowadays the measurement of these are also there. According to the ages also they have identified that Today there are so many laboratory investigations are there. Physical instruments are there. So that's why from that point of view, they are going to make out. Right? About 20 or 30 years back, when you were go to a hospital, first of all, they were taking your height and the weight and all other things. Nowadays, they may not be present in many hospitals because all other gadgets are there now. ECG may be there, and that those things are there. Little bit. But what Ayurveda has mentioned that samamamsa pramanastu samasamhanano naraha vikaranam balena na abhibhuyate shuttipasa atapasaha. Then here, shuttipasa atapasaha. Then shita samsparshasaha. From that samapakna samajaraha. What best explanation you need? If you want to see that your swasthata is there, your health is properly maintained, proportionate build should be there. Samamamsa pramana. So this proportion in the form of sama sammanana should be there. There should not be disproportionate growth. There should not be an additional form of discomfort there, like maybe the form of skeletal deformities or any other things where the sammanana is affected. There should not be a dwarfism as mentioned by Taraka, like a Vamanatvam, Ubjatvam. They are ultimately gives rise to Asammata Sharira. Even today, we can be able to make out those things. We can identify the people who have this problem. Write these words, understand through Ayurveda in the form of whether the person is having a Kubjata or even a Vamanatvam. Both are looks to be similar, but they are not similar. In that point of view, Samasamhana naraha. That's one thing. Next is his Vedic Shamatva should be good enough. That's why Balena Abhibhuyate, Vikaranam Balena Abhibhuyate. Indriya, what is that? Drudendriyaha. Drudendriyataha should be there. What is meant by this Drudendriyataha? Panchañanendriya, Panchakarmendriya, and then Manas. And they should not be exposed to any form of disorders or diseases. They will, because the well-being of the Sara that is there in a human body will prevent the onset of these disorders again. That's why Vikaram Balaram. And what is the nature of the person? Shut Sahana, Vipasa, Sahanatvam, Shita Sahanatvam, and apart from that, Samajara. Very important. Your digestion and absorption are normal. No discomforts will be seen there again. So that these are the criteria that are identified for a good health in individual matter. Even today, if you go to any hospital, they ask this question. People will ask this question. They will examine you from the following points of your life. Do you have any disorders? Have come across with any influences of seasons and all that. So from that point, so health concepts of the present definition of the earlier definition remains the same. The way they explain may be different. Okay. Yes, next.
Sir,
one more question.
Yes, sir. Sir?
Well, before going to the next question,
Sir.
I would like to give a few opinions again. Opinion in the sense actually should have been done even before all this 3 steps and other things. First, I used that word. It is not only the learning but also the teaching, right? So, teaching is also important from the point of the teachers to convey the information properly without being confused by oneself and without being confused others also. These two are to be remembered. That's why first try to make the distinction between the teaching of UG and teaching of PG studies. Always. Remember that. We are not there in the classroom just to throw the informations. Because nowadays, better informations are available in many sources. So many sources we can be able to make out. Teacher may not be necessary at all. But if you are a teacher and want to see that you are better than all those gadgets, your perception about that particular science should be good enough. That's why at that time, what we have to feed to the undergraduate students and what we have to feed to the postgraduate scholars must be invariably known to us. That's the one thing to be known. Second, we'll come back to that point later in the form of Acharya, other things again. While we are teaching the students, we must make sure that there is no confusion in ourselves. We must be certain that what we know is appropriate and it is sufficient enough to convey the information to the student community without being made to or lead to the confusion again. Third point is, I've seen so many people who have plenty of knowledge, but the big problem is to make them or to disseminate to the other community maybe a bit poor because of certain hindrances again. That's why always make it a point that we must know what we are talking about anything as well. We must equally understand what we are telling to the student community. That should be known to us. Right. In this situation, there may be certain form of practical difficulties that may also be there. From my experience, I'm telling these things. First thing is that we should disseminate to the student level. Unnecessarily, there is no need for us, especially in the undergraduate level, no need for us to tell whatever the information that are there and just make the students feeling bored. That should be avoided. The next one is always and almost always our explanation should be simple, direct, and practical. What we speak, that should be shown to the people. And it should be direct enough, no indirect information. That's why if you want to see that the information should be direct, give sufficient plenty of examples through which they can easily understand the task what you have given. Then, one difficulty that may be there, even in the postgraduate learning also, this difficulty is there. Unless we know the fundamentals of the subject of the previous years, continue to the next subsequent years is difficult. And it may not be uniform in all the students, because all the students need not be expected to come around with their good institutions. When that situation is there, some may be weak in understanding this earlier subject like Acharya. That's another difficulty that is there that should be known to us. And one more problem is, compared to the previous years, in the sense of about 30, 40, 50 years back to present year, generally there is a deterioration in the student interest. The reason may be plenty enough. Why the students are not much interested is, the entire learning is focused upon getting the marks and other things. That should be avoided. Getting marks is different from getting knowledge. That should be. Next, it is from the point of institution level, management may expect a better result. From the point of teacher level, teachers' learning itself may be deficient, may not be sufficient enough to convey that. From the university level, unfortunately, they said that it should be student friendly. These things are there. That may also affect that. So keeping all that, we have to continue the task of continuing with any subject, especially from the point of Roga Nidana, we have to do a justice to what we are doing. Okay, now, we can, Dr. Gopikrishna, we can continue with another questions that may be there.
Yes, sir. So whatever the dear listeners, whatever the information is provided by Prasanna sir, is highlighting why we have to study this particular subject. So that is start with why is considered to be the first and foremost thing that is essential for the future learning, for the deep dive understanding of the subject. So now, so let us look into the next point as such. Question is, there are certain subjects that are dealt in the first year. There are certain subjects that is Ayurveda Itihasa and Samskrita, wherein Ayurveda Itihasa is very little it is being dealt, and Samskrita, most of the students are not having the knowledge of the Samskrita. It is being said that around nearly around in an India 140 crores of the people, less than 25,000 people are having the knowledge of Samskrita. So this is again the another major thing, that is the for certain subject, that is Padartha Vijnana, Kriya Rachana Sharira, they are being dealt. But the knowledge that is being dealt in the first year, they are not going to carry in their second year. And whatever the knowledge they are going to learn in the second year, they are not going to take this knowledge into the third year. So this is the actually the one of the major lacuna that is happening to all of the what do you say, the learners. So sir, how can we able to integrate these informations? How can we be able to say the connection, how to make these connections so that they can able to develop their own better self in the coming days?
Right. Oh, well, this is another one of the important questions to be known before we study Roga Nidana. Again, to go back to the same line. Swastha Atara Parayanam. First line is Swastha, then Atara. He never mentioned Atara Swastha Parayanam. So this Swasthata should be known. Then only we can be able to make out the distinction between the Swastha and Aswastha. That's why when we want to know the Swastha, we must be in a position to know how our body functions. What are the factors that decides the function, normal functions of the body? Is there any changes from one age to another, one situation to another? All are to be known in the first year subjects. And there are very, very connecting subjects also in relation to this knowing of Kriya Sharira and Rachana Sharira. There is no doubt that Kriya Sharira and Rachana Sharira forms the basis of understanding of Roga Nidana. And again, I'm telling you, any teacher or any students who should be well versed in Roga Nidana must have to be well versed with Rachana Sharira and Kriya Sharira. Unless this is done, the study of Roga Nidana will be incomplete. I told you, because unless you know what is going on normally and where the exact abnormal situation resulted in, how can we understand this? That's why even for a teaching community learning Roga Nidana, this basis must be there. Then, from the point of the student community, I already mentioned the one of the reasons. Difficulty is there. In many situations, it's not equally disseminated from one person to another person. So a person may be weak in these two subjects because of the environment, an institutional environment also, which I don't like to comment more about that. But still, practical difficulty is there for a teacher now. One may grasp Roga Nidana very easily, the other may find difficult to follow this easily because his basics are poor. And allied subjects that are there to support Kriya Sharira, Rachana Sharira are, number one is Padartha Vijnana. Understand that. So, if you want to say that your Sharira, Kriya Sharira is good, your Padartha Vijnana should be good enough. If not, there is a difficulty. Samanyam Sarvabhamanam Samavriddhi Karanam means. So, you have to make out this Samanya, Vishesha and other things. You should go to Padartha Vijnana only and try to apply that in relation to Kriya Sharira and Rachana Sharira. This is what the present medicine also says the same thing. For their better understanding, they need not only study physiology and anatomy, they study biochemistry as an allied subject. Right? So then similarly here, this what you can call the Vaisheshika Jnana, Sankhya Jnana, all the components which are found in the Padartha Vijnana at least, that should be known to us. Then only the fundamentals will become strong, so that we can be able to make out certain distinctions that may be giving rise to the altered activity in the body and leading to the disorders again. That's why invariably we have to attain that. The next problem is whether the itihasa is required. But there was so much of discussions taken place. Is it something what is required in the first year itself? Is it not good enough to make it in the final year? I will throw in that itihasa at all. What you had to do out of itihasa, and all were the questions that were posed earlier, even in the university level, there were so many discussions. But let us remember one thing. We do not know how much we have gone forward unless we know how much back from which we came forward. Remember that. So that is the reason. Let us not forget the previous efforts that has been resulted in Ayurveda Itihasa, not only this Sarva Charkar Sushramit, all that was there in relation to the diseases, disorders, and all that is there in the Itihasa are essential components. And if you once know that, we will be positioned to see, oh, how later, how much we have been moved forward can be known. At least from that point of view, Ayurveda Itihasa Jnana is absolutely an important component. That's why it should be better to study in the very first year itself. Okay. The next, with the integration, how to integrate these things. Another problem is to integrate. So integration means, again, but better learning, when we say that there is an Agni Mandya, example, first decide that what is this Agni at all? How does it function? Why so much of importance is given? And say that Kayajiksa is a condition where entirely depending upon the normal or abnormal features of the Agni itself. Is it true? This question should be raised. And if it is true, how can we understand that it is true, it's a fact? Then we have to go into the books and decide that. For that, Agni Manya, first thing is we should know what is Agni, at what level different forms of Agni are named. Please remember, they are named there again. Accordingly, how specifically they have given relations to the form of acclimatization, adaptation to the body. That's again, to come back to that word, Samayoga, mentioned by Tarkadya. How the Samayoga takes place? We are eating, you were saying, one small example can be given. We are eating plenty of foods. What the present people may say, anything in the form of protein, carbohydrate, fat, and whatnot. But I don't want to say anything about that. What I would like to say is, you are eating the rice, you are eating the sambar, you are eating the payasam, you are eating something, vegetables, and all that. They themselves will know, go there in the go into the body and the sticks in any way, any part of the body as it lies. All this will be converted into the Sharira Guna. That means there is a conversion of Ahara Guna into Sharira Guna. A big mechanism is taking place in the body, to which Agni has to play a very important role in different levels there again. And that should be understood. And when once we understand this, we will be in a position to specify which part of Agni is affected, through which part of the Dhatu is affected, through which part of the Slotas has been suffered, through which situation of diseases are resulted. When we know this, we can be able to decide whether the type of counter that can be made out. Necessary for us to look into the integration of the previous subjects to the present subject. Okay, next. How to integrate, I have mentioned it now already. How to carry forward information to next, one more question is there. How to carry forward the RNVV into third BM? Right. Very nice question. Okay, we are necessary that previous subjects should be done. What about the later subjects? I already mentioned that. If you want to have an Aushadha Jnana, Hetulinga Jnana should be there. That's the first thing. That's why always everybody should understand one thing. Roga Nidana is not at the college alone. Please remember this. That's why they were not fools. When they have mentioned that Ashtanga Ayurveda, Roga Nidana was nowhere. Agreed? Yes. But the fact is, Roga Nidana is everywhere in all these 8 anga. Without Roga Nidana, there is no question of any Kaya.
Think
Disorder has been during that time. Again, further information like Rija dosha, Agantika dosha should be made out there again. Dosha Anubandhata or Anubandhyatva should be made out again. And every information is there in the book. Why we find difficulties, we did not go into that at all. Is it? Apana need not be expected to make the similar function of a pranavayu. That is the case, would not have mentioned as apana itself. Then, what is the extent of a pranavayu in the body? Area is found. Then where the prana is not found? Prana is not found in the kesha and loma. It is not there. That is the reason if you even cut that, you do not feel the pain at all. That's the reason. In the kesha and naka, other than those areas, prana is everywhere. So from that point of view, to understand this difficulty is our lacuna. First is how we need to read, we need to study further, we need to focus on that further in a position to make out clinically also. Remember that. How to simplify? Method of simplification is try to separate from one to another easily and remember that. I have mentioned that, pranavayu function. Just keep that as a mental image. What is the major function of a pranavayu in which it is related with that? Pranavayu, most of the times, essentially functions with indriyas. So keep that in mind. Then you know the indriyas. How exactly these indriyas are responding to the pranavayu, try to make out that again. How the hridaya responds to the pranavayu, try to identify that again. How the vayu that is being taken from outside converts into pranavayu within the inside, leading to the life activity that is being taken place. In that way, try to connect it and then you will get the answer without destroying the original information. That's the reason. Connecting the dots and build our database more than that, we should be in a position to understand it in a proper way. Simplification will be there naturally. Right? Because apana function is elimination. And this elimination timing is not the same. Elimination of physical matter is usually once in 24 hours. Elimination of both ways 6 times every Acharya mentions, maybe in that point. Elimination of fetus is normally after 9 months. Acharya clearly says that. That means those apana is functioning in all these 3. Timing of them is also different. If this timing is affected, you can expect a problem that may be ensued later. Sooner or later, they can be able to. So if it is earlier, there may be difficulty. If there is a later, there is also difficulty because the body will consider themselves as foreign bodies. The same fetus may act as a foreign body if it is delayed. Mother may be in a distress. And so till 9 months, it is a position to accept it. After that, it becomes still later, there is a difficulty. That means the same one, maybe in the form of affliction can be seen. That's the reason we must be in a position to understand this from the site, from the nature of activity, timing of activity. You try to analyze that, your information of dosha will be simpler. Got it? Okay. Next, how to elicit the desired data from the client's visit, your clinics and hospital. First of all, decide how to record them. Most of the doctors do not keep the record. Yes, earlier, luckily nowadays, one major development has taken place in all the institutions, whether rightly or wrongly, you can find the records there at least nowadays. Earlier, when we were studying, there was no record at all. There was something that was there, and people were not bothered about keeping the record. Only thing is patient and doctor relationship. That's all. Patient believing Vaidya Narayana Hari, doctor believing that the patient is mine. That's all. So from that point, the treatment is going. But nowadays, it is not the case. Unless you keep a record properly, you will be in a distress a day or later. That's the reason. So clients visit, how to keep means, again, assessment should be from the iron. Right from the history taking till the what you can call the diagnosis, the prognosis is made. All that should be data-wise. Today you prepare such a data where you can be able to write that information, that at what stage the patient has come to you. After 15 years, what was the stage of the patient that has been seen? Try to again continue with this and modify it whenever the situation is required. And then later you say that some of them can be deleted when the patient responds properly. Give the reason the medicine that has given to you, given by somebody has ultimately given rise to this abnormal to bring back to the normal activity. This can be definitely done. And that nowadays there are so many data-based information are already there. Try to make out that. That's not a difficult thing. The last question is in this context is how to begin a Rogi Pariksha. Even today, this is a problem. Many times say that should be begin with the what is that? Interrogation. Prashna Pariksha. But Charaka says Darshana Sparshana Prashnam Cha Pariksha Trividha Rogena. Trividham Pariksha Rogena. So Darshana Pariksha, Sparshana Pariksha, and then Prashna Pariksha. Order was altered there again. It is something which is not strictly correct. Because is it from the Darshana Pariksha or is it from Prashna Pariksha? If you think that interrogation and physical examination, then the point is interrogation should be done, physical examination should be later. But it is not the case. Even you can be able to make out certain form of abnormalities when the patient enters your ward or enters your chamber. Isn't it? Somebody comes with stiffness, with the face and fist and everywhere. Somebody comes with involuntary movements there again. That is Darshana. Even before you ask the question, you can be able to make out. Somebody may find it difficult to walk due to the neurological disorders again. That can be seen in the beginning only. But seeing and observing are different. Patient can also see, you can also see, but what the patient cannot see be seen by you. That's why observation is important. At the time of observation, there should be some methodologies. That's why Prashna Pariksha is ideal. So there you can definitely make out all the permutations that are there in the Ayurveda. And that should be again from the point of Trividha in that Prashna Pariksha. Then Shadvidha Pariksha that has been mentioned by Charaka through the Prashna Pariksha is also there. Panchendrita Pariksha that can be adopted very easily. Or take the information from the a particular form of Dashavidha Atharubala Pariksha. Out of that 9 are actually the one. The 10th one is a Vikriti Pariksha. Other than that, all 9 should be examined in the patient again. And then there's no difficulty. The reason is all that symptoms are clearly manifest, clearly explained there. Only the question you have to go through that and understand that and put into practice. Tattva Pariksha can be made out. Hara Pariksha can be made out. Is it? Samanana Pariksha easily could be made out. Pramanataha Pariksha. Nowadays we have this what you can call the Yukti in the form of measuring tape and made out. Nobody will question you. Pramanataha Pariksha can be made easier. Right? Earlier Anguli Pramana Pariksha was there. Nowadays one more method may be different, but our purpose is the same. So keeping all that in mind, Rogi Pariksha should be started, and again ideally from the point of Prashna Pariksha. Because through the Prashna Pariksha, we may be in a position to elicit so many informations through which can come to certain form of conclusions in the form of Prashna Pariksha, like what you can call Anumana Pramana Pariksha. So all Anumana Pramana came the Prashna Pariksha, Prashnataha Pariksheta, Charoginam, Charka clearly mentioned in Numata, isn't it? So Prashna Pariksha is the ideal one. Then with regard to the Pratyaksha Pariksha in the form of Darshana and Sparshana can be made. To that, many other things are added in this Darshana and Sparshana. Nothing wrong in it. So, in that point of view, to begin a Rogi Pariksha, our observation should be clear. First thing. Next, our mindset should be in such a situation that we must focus on the exact problem of a patient. Instead of taking so many information at a time and making the patient confused and making yourself confused. That should be avoided. It should be focused. Many times the patient may go wrong. He may not know the importance of the problem that he may have come across to you. At that time, you know that you can bring back to the normal rails so that he can be able to pinpoint his problems properly, so that your problem will be easily related. So that's why Rogi Pariksha, all that are there in the books can be brought into practical applicability without any hindrance. Okay, Ashtasana Pariksha is there. In that Mutra Pariksha, everything information are there, that should be brought into practice. If once it is brought into practice, everything is one more information is with regard to the with regard to what can Ashtavida Pariksha only. In that one problem that is there about the Nadi Pariksha, Ashtasana Pariksha, Nadi Pariksha. Nowadays there are so many specialities are there, specialized people are there with regard to Nadi Pariksha and other things. But what it surprised me, look into Charaka Samhita, the importance of Nadi Pariksha has been either given very low information or no information. This surprises me. Why? When so much of information has been given on so many conditions, like Mutra Pariksha is there, Purisha Pariksha is also there, Jikva Pariksha is also mentioned in that. But other than a few informations with regard to Nadi, in the Indriyasthan, nowhere can you be able to make out the systematic study. Only the Ravana Kruta textbook or some other conditions, you can be able to make out some of the information Nadi Pariksha. But people say that I have highlighted much about Nadi Pariksha. And surprise is why Charka has not explained this. This question always hinders me. Anyway, in that that's the reason how to begin the Rogi Pariksha again. There is no stereotypic method. Question is ideally from the point of Prashna and then go with the other things. Okay, then. Further?
Yes, sir. I think now still much more are there, but now as the time is approaching, now let us look into the 5 main steps, 5 major steps of Roga Nidana. What should be the first? What should be the second? What should be the third, fourth, and fifth? Is it possible to summarize, sir? So, what should be a person? It is what should he has to begin from the 1 to 5. Is it possible to say for the learners as well as the teachers?
Do you want to tell you about that?
Yes, sir. Now it is the.
You want to continue that? No, you even if you continue, no problem with me. The first step is the very first step is first know how and why of a disease resulted. How a disease resulted, why a disease resulted. I will ask one question. Very simple question that ultimately always hinders me. In a disease like a prameha, Sarkar clearly mentions there are about 20 types of prameha. Right? And we also believe that Ayurveda has propagated nearly 5,000 years back. Forget about adding the 21st prameha to that. We have not done that anything at all. But have we identified all the 20 so far? Where have we failed? Especially nowadays, so many gadgets are there to make out them. Earlier, there was nothing with the people of like a charka or somebody. Even the paper was not there for them. They are making use of these leaves, palm leaves to write and record. Now we have so much of vertical gadgets and information where you can be able to make it. Have we been able to make out? If not, why? That's right. Try to know why and how a disease is resulted. And when once they try to analyze about those things properly, second step is go to basics earlier. Without going into the basics, it is impossible to move forward. More you are strong in your basics, the better you are in a position to understand the subject by yourself and make the people to understand that later. Third step is to keep an environment to invite different thoughts from different sources, which will be the better position for you to improvise your or others' knowledge also. Fourth step, give importance to the practical sense of the subject. Then only the student community will appreciate and accept it. Whatever you explain, that should be felt by the student community. That should be understood by the student community. For that purpose only, Roga Pariksha and Rogi Pariksha should be clear to us first, then to the next student community. Fifth, continuity, improvisation should be a norm in our day-to-day practice. No one should think that his education is complete. No one should think that he is final in that information. And it's impossible. If somebody thinks like that, it will be stagnated. That's right. Always, as you mentioned, start with why, then complete with how. How and why ultimately helps us to better distribution. That's why Satata Adhyanam Madaha Paratantra Avalokanam. The only way to make oneself clear, to make others clear with the information. So I think I can thank you all of you for the most patient hearing. Okay.
And we are also very grateful.
Questions?
We are also grateful to Prasanna sir for sharing his 40 years of experience in this particular 90 minutes. So which is very, very difficult thing. But still he has tried his level best, and he has given us very important insights so that we can take forward to the coming generation. So now, is there any questions from the audience? So let us have the questions to a discussion. So any questions from the audience? If they want to have the interaction, just keep a raise your hand so that we can have the interaction with the person, the speaker itself. Yes, any queries?
Even during my classes also there were no questions. I was very lucky from that point. Even there will be no questions. I know that. That suggests only two of the things, either possibilities, isn't it? Either
Any
everything or the thing.
Any queries from the yes, Madhuri? Any queries? Hello?
I think there are no questions.
One question is there, sir.
Ah.
Is Roga Nidana is non-clinical branch? It's a question mark.
Okay. This is from point of academic concern, isn't it? Question. If you say pathology non-clinical, I accept. If you say Roga Nidana non-clinical, I don't accept it. Because Roga Nidana is not a pathology, but textbook of pathology. So, if somebody says that it's a pathology, I must have to intervene and tell them they are wrong. Not my point. Reason is very simple. In the book of pathology, clinical pathology is related to clinical medicine. So that means it's a part of people of scientists. But here in Roga Nidana, unless you go to a word, there is no chance of you to understand Roga Nidana at all. Roga Pariksha and Rogi Pariksha, both of them are the part and parcel of a Roga Nidana. Rogi Pariksha, Roga Pariksha. So when you once say that it is Rogi Pariksha that is to be done in the form of clinical aspect, who do you say that it is a non-clinical one? It is not that through the laboratory or learning. It is not through the radiology or learning this. It is not through the histopathology or learning this. Our asset is the patient. Patient is the only one through which you can be able to make out it is. If not, there's no chance. When that is the situation, how do you say it's a non-clinical thing? All this has happened because of somebody's opinion that pathology is equal to Roga Nidana. I think it is equal to internal medicine. I don't know that whether internal medicine and scientists are same or not. Because scientists is very clear that it's Antaragni Chikitsa. Whether internal medicine explains the same thing like a internal fire treatment. Is it then anything like internal medicine is nothing but internal fire treatment? I don't think. So when that is the situation, it's very difficult to compare the present subjects or present topics to our ancient topics. That's why clinical is a very clinically subject, a clinical subject. It should be a part of a clinical medicine, a clinical part of a understanding of the disorders again. If no patient, no reason at all. Remember that. Roga Pariksha is not possible unless a Rogi Pariksha is there. But in the pathology, they don't need sufficient enough. Rogi is not required for them at all in most of situations. A part of something, a product of a Rogi is sufficient for them. Take one sample of a specimen, take one sample of a urine, take a sample of your stool, you can finish. Your pathology is over. But it's not the case with Roga Nidan. That's why it's a clinical subject. Till 2015, every effort was made to be a clinical subject. I don't know what happened later.
One more question is there, sir.
Yes,
so,
please.
what kind of research should Roga Nidana graduate concentrate on? Whether is it disease oriented or pariksha oriented?
It's absolutely a very good question. Here, some more addition should be done. Some more addition. That's why I said one information already. Roga Nidana should be the part of all Ashtanga Ayurveda. Please remember that. It's a part of Ashtanga Ayurveda. So when that is the situation, invariably the teachers concerned with that, professors concerned with that, faculty concerned with that, must have to associate themselves with all these clinical disciplines. Not only with Chikitsa. They should be Shalya Chikitsa. make out that whether a tumor found there or arbudha found there, is it sadhya or asadhya, should be assessed by a Roga Nidana expert, not by anybody. Remember that. So from that point, from the Sri Roga Prasuti Tantra, reason why and how the things are delayed. So when you take a patient, give a subject to the people at the time of studies, giving a form of a thesis, writing anything, see that the field should be enlarged. At least from the beginning, can we make this beginning? Associated with the Sri Roga department, Prasuti department, associated with the Kalya department, associated with the Obarabhata department, and see that. Because in all these areas, disease may be same, the condition may be different from one to another. Right? So accordingly, the information may also be different there. So that you can be able to help them. So that your knowledge will be invariably enlarged. So from that point, this should be ultimately disseminated to other organs. It's not simply now, it is just a part of patchwork of bronchitis. Even patches people may not directly agree that. The problem is that Roga Nidana is something untouchable, and that should be avoided. Okay, then. Anything else?
Any other questions?
So you give it whenever the teachers are there, they have to give subject like that.
Okay.
When I teach Nidana specific to Vyadi, again, what is that reading question?
Okay, I will unmute Dr. Sharada Spurti. So, is it possible to ask the question itself?
Hi, sir. Yes, yes. Namaste, sir.
Namaste.
Sir, I was your student in SDM Udupi. I hope you remember me.
Dancer, sir.
Hope so, because aging always affects us. Because number one is that already 10 years are there. 10 years are completed now. Yes. Now I remember it. Right. Good.
Yes, sir. Sir, I'm currently teaching Roga Nidana. So I did my PG in Roga Nidana from SDM
very nice. Okay.
So I'm very thankful to all of you, first of all. My question is, sir, like when we are teaching Nidana to the students, like with respect to a Vyadi, when we are explaining, there are so many Nidanas. So first of all, one thing what I felt when I'm teaching is it is time consuming to explain each and every Nidana to the UG level. Even with respect to Purva Rupa, like I say, Angamarda, Ruchi, and ultimately students end up writing same Nidana and same Purva Rupa, same Lakshana to any disease because they don't consider their paper to as serious as it is applicable practically. So is there any easy method so wherein we can inculcate the important Nidana and Purva Rupa and tell them this is the highlighting point wherein they have to stress on this particular Nidana or Purva Rupa?
See, in reality, there's not a difficult thing. The reason is quite simple.
Yes, sir.
When you ask, that's the reason I said that. There should be some difference of teaching between the postgraduate teaching and undergraduate teaching. In the undergraduate level of teaching,
yes, sir.
whenever you want to say that this is the reason behind the occurrence of a disorder, try to find out the main cause, what can call the causes that are related to the causation of a disorder. Forget about all the accessory conditions. No need to explain them. Because in everything, this is the situation that we found. That is the reason many times the people like Mityahara Vihara Abhyam. That's right. But what is that Mityahara particularly causing the disease like a Prameha, disease like a Saulya, disease like a Amlapitta, disease like a Tamaka Shwasa? There is a difference. Mithya Vihara in Tamaka Shwasa is different. Mithya Ahara in relation to Annadrava Shula is different. So you please try to pinpoint those causes which are directly responsible for that. That is the reason almost always confine your information to the Pradhana Karana. Anubandhi Karana can be easily deleted out of that in undergraduate level. But in the postgraduate level, all these are necessarily required because clear cut what you can call explanations are required for them to make out that. But in the undergraduate level, try to give the main causes that are responsible for that. In the Prameha, if you just write two informations, that is, one is less exercise, other is overeating. Initially, we understand that they know the reason.
Okay.
Because that causes the imbalance. gives rise to Praudya or a Prameha later. But in the post-graduation, you cannot expect that. You have to explain what exactly the meaning of this. How exactly different from exercise means it is different from one age to another, one person to another. So assessment is required, detailed assessment, but need not be in the usual level. That's right. First, concentrate on this Sannikrishna Nidana, first of all. Sannikrishna Hetu. Then, in relation to that, try to develop a Samprapti there. In the Samprapti also, no more details will be required out of that. Common Samprapti is sufficient enough. Sufficient enough. Let them know only those things. And then with regard to the Sadhya Sadhyata, Adishta Lakshana, whatever that are there, you can just ask them to know that. That's all. Because all this should be shown to the student when he goes to the world. Then his mental image will be permanent. Because he has seen that, he has heard that, isn't it? Whenever, whatever, that's why I said earlier. Whatever you speak in the classroom, it should be shown to the patient in the clinical class. Then your teaching will be better. Okay?
Yes.
Simplify that.
Thank
Simplification is important. Okay.
Thank you, sir. Thank you so much.
Okay, welcome.
Isha madam. Please, madam.
Hello, sir. Namaste.
Oh, namaste. After a long time. Good.
Very long, sir. Very long.
How are you?
Yes, sir. All good, sir, with your blessings. And 3 generations of your students are getting this information. I'm not asking a question. I'm asking a suggestion for you because so many things are quite haphazard in the syllabus, maybe old or new, related to the ancient methods of disease diagnosis and modern methods of disease diagnosis. People are confused and they just don't know which one to opt out, because every time modern diagnoses are keeping on changing. They change their values, they change their methods. Sometime earlier it was manual, now it is completely automated. So do we need to run behind the upgradation of modern techniques, sir, or shall we just stick on to our own methods of pariksha? Kindly suggest so that we can clarify this amongst our students.
Yes. If you ask me this question, then my answer is that stick on to the facts. Facts. If there is some facts with regard to modern medicine, accept it.
Yes.
Number one. And if the facts are there in Ayurveda, invariably follow it. Please remember that. Acceptance is different from following that. There's no second question that is to be asked when you are going to follow that. Second,
yes,
the question is, as you mentioned, nowadays the problem is that even I have experienced that. Nowadays, though, even clinical teaching is also totally different, because most of our present diagnosis depends upon the investigations. Whatever the reports that are there, yes, whatever the reports that are there, that will ultimately decide the diagnosis in a patient. I have seen so many specialists even neither keep the stethoscope on the chest of the patient or anywhere over the patient, neither touch the patient, forget about pulse examination or other thing. There is absolute option. They will take the report, accordingly write the treatment, and they will send the people. That means we are totally mechanized now. Our life is mechanized, our patients are mechanized, our diseases are also mechanized now, isn't it? So,
true, sir.
Better from, instead of changing from such situation, first let us have the faith in Ayurveda. Let us continue with what we were doing earlier and what we are doing nowadays. So, stick to the basic principles of that and have your own choice of selecting the medicine basing upon that basic principles that are there. Follow that. Instead of that, really depending upon, say for example, as you mentioned here, very nicely mentioned, about the norms that are being prescribed for the values of a blood sugar and other situations, it is totally unexpected. We don't know what happens after 10 years. Then what is the situation where we have learned so far? Somebody keeps on changing, and why do you want to keep on changing? I have a strong hope that they are coming to us a day or later. So from that point, if you ask me that, stick to our basic principles, diagnosis according to the principles of Ayurveda, because we have studied that. and treat the patient strictly according to that. That's a better thing if I'm
Right,
not
sir.
wrong. Okay.
Right, sir. Why? Because the the value of cholesterol was 250 mg per deciliter when we were your students, and now
Yes.
they are showing 200 mg per deciliter as a normal value
I
for
know,
the student.
yes. Right.
And yes, it happened to my father that he had to take, even though his was in a normal limit, he took medicine from his physician, and unfortunately he started getting gallstones, and that got impacted in the pancreas. And I totally believe it is iatrogenic just because of the value variation.
Exactly.
So
Correct.
that's why I wanted a validation from you, sir. So to better go with our own methods of investigation. So
Yeah,
thank you
stick
for
to the
that.
cover method, definitely. Okay. Right. Thank you.
Thank you, sir.
Thanks,
Any-
Dr. Nisha.
Any
Okay.
other? Any other queries?
Dr. Subramanian is still there? Subramanian?
Yes, sir. Subramanian is still here.
My question is, has he come across with any problems while teaching?
Namaste, sir.
Namaste.
It was very nice to hear from you lecture again, sir.
It's nice of you. So nice of you. My question, you got my question now.
Yes, sir. Yes, sir. Yes, sir.
I'm very sure that you will never come across with any problems with the students, because students are just like the great sages of our country. They will take everything as it is.
Nowadays, previously when I was teaching, sir, students were biting the slokas and this one. But nowadays, it is, I tell how much times to students, 10 times, 20 times, bite the slokas, but they are not doing their homework. So how we can handle this to the student, whether slokas are necessary, whether I only get confused whether I am bombarding the students to learn slokas of Samprapti, learn slokas of Saman Lakshana, Pratyatma Lakshana. So whether it is my fault or I don't
No, it's an
know.
environmental fault. Because all this should be started right from the beginning, from the very first year itself. If the teachers of the first year themselves made the students to get prepared for this information, they will definitely follow it. If not, if suddenly if you want to say that it should be there, then how can a student can adjust according to the whims and fancies of a teacher? It's very difficult. Isn't it? That's why it should come from the basic level. Then only it is possible for somebody to make them. That's the one thing. If not, you should be so strong enough to see that you should command them and do it. That's the only two things.
Yes,
I
sir.
think it is also being said that is, if you are remembering properly, then connect and building is also ideal. It can be very, very easily
We have
done.
we have to highlight the importance of understanding a shloka. What you can explain in about 10 sentences can be made in those 2 lines. Make to understand. That's why you have to impress upon them, and it looks to be difficult in initial stage. But when once they are conversant with that, they will be feeling happy. Isn't it?
And another one, sir, in all the text we get across the ancient Nidanas, Pinyaka and all these. But nowadays our food lifestyle all changed. Whether we have to change the Nidana, we have to change according to the our modern lifestyle, the Nidanas, which should be added to the diseases while teaching.
Here 2 things are to be done. Very good. So 2 things are to be done. First of all, you should know what exactly those things are, which were recorded in Ayurveda. Second, how many of them could be identified now? That's the second point. The third point is anything that is being found nowadays which may consider to be resulting in giving rise to disorder, that can be easily added. Because that is a fact. I already mentioned that facts cannot be altered. It is not that Ayurveda or a modern medicine or something. Facts are always facts. Accept that and try to identify and understand from the principles of Ayurveda. That's the thing. Got it?
Thank you, sir.
Yeah, if you add a tomato, I don't think the tomato is an Indian product. But tomato is a very frequently used substances. And we know that Rasaguna, Viryapak of all that. When that is the case, we can explain accordingly what it may result in or why it may give rise to. may be explained accordingly. But there should be some justification behind your addition.
In the contemporary context of etiology aspects of Vata, Pitta, Kapha, they have I have made the students to work upon it by referring the articles and this one, sir, to make a
Very nice.
so that they can put in the clinic and they can also develop.
And people will appreciate that. Definitely correct. You are right. And that's what information should be very simpler and direct, so that the patients can also be in a position to understand the importance of their food and other activities. You have to write it in their knowledge, in their language, simpler language, not a technical language.
Thank you, sir. Thank you.
Okay, welcome, doctor.
I think no other questions are there from the audience. Sir, I think we
Anyway,
will
I thank
wind up.
Dr. Spurti for her memory of all the shlokas that she learned in during my class.
Yes, sir. I'm
Very
able to
nice.
reproduce in my class now.
Super, very nice.
So I'm only we know when we are getting into teaching only we'll make out like when we are
Naturally, it happens.
practicing. When
Exactly.
we learn in UG, we feel it's a burden. I never felt that way, but when I'm sitting in a clinic or in a class, I'm really grateful. I've spent that days to learn the shlokas. It's very much helpful, actually. Thank you, sir.
Correct. Okay, welcome. Right.
Yes, sir. I think we will wind up the session, sir.
Right.
I will be giving my sincere gratitude to Professor B.V. Prasanna, sir, who is a teacher as well as mentor in the field of Roga Nidana. I am from all the audience from the along with that, I am personally giving you this. Thank you very much, sir, for giving that much almost 2 hours with the particular audience. Thank you, sir. And
Thanks, Dr. Gopi Krishna, for your invitation.
Thank you, sir.
Thank you.
And I sincerely express my gratitude to all these true Ayurveda Roga Nidana learners who are the torch bearers of the particular subject so that we can give the right knowledge to the right audience at the right time, right occasion to solve the right problems. So this particular whole video will be available in YouTube live. It will be available, so you can go through that at any point of time for your future references. Yes, sir. I think thank you one and all, sir. Now we will wind up the session, sir. Thank you, sir.
Thank you very much, and thanks all the good listeners. Thank you so much.
Thank you.
Okay then.
Thank you, sir. Thank you, Gopi Krishna, sir.
Thank you, Subramanya. Thank you. Thank you,
I
Nisha
request
madam.
to further also conduct such webinar
ಆಯ್ತು,
series.
ಈ ಟಾಪಿಕ್ ಹೇಳಿ, ನಾನು ಸರ್ ಹತ್ರ ಅಥವಾ ಬೇರೆ ಯಾರ ಹತ್ರ ನೋಡ್ಕೊಂಡು ಮಾತಾಡ್ತೀನಿ.
Yes, sir. On the new topic of our curriculum, sir, new syllabus.
ನೋಡು.
Few topics are
ಹೇಳಿ
there,
ಯಾವ್ದಂತ
sir.
ಹೇಳಿ ಅದನ್ನೇ ಬೇಕಿದ್ರೆ ಅದನ್ನೇ ಮಾಡಿಸುವಂತೆ. ಯಾಕಂತ ಹೇಳಿದ್ರೆ ಇದು ತುಂಬಾ ಆಕ್ಚುಲಿ ಇದು ಸಿಲೆಕ್ಟ್ ಮಾಡಿದ್ದೆ ಅಂತ ಹೇಳಿದ್ರೆ ಓವರ್ ಆಲ್ ನಮಗೊಂದು we can able to have the overall idea so that we can go in one particular direction.
ಅಂದ್ರೆ ಕೆಲವುದೆಲ್ಲ ಟಾಪಿಕ್ಸ್ ಡಿಜಿಟಲ್ ಹೆಲ್ತ್ ಅಂತ
ಅದೆಲ್ಲ ನೋಡುವಂತೆ
ಆರ್ಟಿಫಿಷಿಯಲ್ ಇಂಟೆಲಿಜೆನ್ಸ್, ಇನ್ಸ್ಟ್ರುಮೆಂಟೇಷನ್ ಅಂಡ್ ಬಯೋಸೆನ್ಸರ್ಸ್, ಮತ್ತೆ ಡಯಾಗ್ನೋಸ್ಟಿಕ್ ಟೂಲ್ ಡೆವಲಪ್ಮೆಂಟ್ ಇನ್ ಆಯುರ್ವೇದ, ಮತ್ತೆ ಎಮರ್ಜಿಂಗ್ ಡಿಸೀಸಸ್ ಅದರದ್ದು ಪ್ರೋಟೋಕಾಲ್, ಅದೆಲ್ಲ ಹೊಸ ಟಾಪಿಕ್ಸ್ ಆಡ್ ಮಾಡಿದ್ದಾರೆ ಸಿಲೆಬಸ್. ಅದರದ್ದು ಬಗ್ಗೆ ಒಂದು ಇದು ವೆಬಿನಾರ್ ಇದ್ರೆ ಒಳ್ಳೆ ಇತ್ತು ಸರ್. ನಿಮ್ಮ ಹತ್ರ ರಿಕ್ವೆಸ್ಟ್. ಥ್ಯಾಂಕ್ ಯು ಸರ್.
ಥ್ಯಾಂಕ್ ಯು ನಿಶಾ ಮೇಡಮ್. Nisha madam, thank you. Sharada Spurti, thank you. Vaijayanti,
thank you, sir.
Thank you, madam.
Thank you, sir. Thank you, sir.
Thank you, sir. Thank you, Vaijayanti. Thank you, Dr. Shaila. Dr. Ashwini, thank you very much. Dr. Dikshita, Dr. Sneha, Dr. Basavarajji. Thank you one and all for the attending this particular session.